Now, hi everyone, and welcome to today's The Future of ISO 45001 webinar. The new accreditation has been a hot topic in the last few months amongst health and safety professionals and organisations across the globe. So today, what we wanted to do was discuss the subject matter in further detail. And so this morning we are joined by our panel of health and safety experts. Firstly, it would be our first panelist is Bridget Leatley. Bridget is a health and safety journalist, trainer and consultant, predominantly working in the UK. We also have Chris Ward, who is a member of the BSI committee and was responsible for OHSAS 1801 and the HSG 665. Billy O'Brien is also on the line, and he's a former health and safety consultant, and he is a director of customer success for Effective Software. So throughout the actual webinar today, this morning, we want to be able to take your questions. So you can take your questions via the right-hand side panel, and you can send anything over to us, and we'll hopefully get the questions posted to the panelists as much as possible. But again, there is over 100 attendees, so we probably won't be able to get back to you on all the questions, but we'll try and treat them as quick as possible. So without further ado, I'd like to introduce you to the panelists.
Okay, yeah, great. So I suppose Billy here. So Chris, do you want to maybe just do a quick kind of intro and your background for everybody that may not know you?
Yeah, thank you, Billy. Yes, I'm Chris Ward, and I worked for the Health and Safety Executive in the UK for 37 years, and I am now a consultant on health and safety management systems, and I investigate fatal accidents around the world. And as Dave said, I revised HSG 65, the Health and Safety Executive's Guidance on Safety Management Systems, in 2013. And I can remember attending the first presentation of HSG 65 in 1991. So memory goes back quite a way.
Wow.
Thank you, Billy.
Brilliant. It's great to have your level of experience on this webinar this morning. So yeah, no, it's brilliant. And Bridget Leatley, also on the panel this morning, and Bridget has been with us on a number of occasions. So maybe Bridget, just for any new attendees this morning, you might just give us a quick intro.
I think you've already covered the headlines, which is, as you say, I'm a health and safety consultant first and foremost. I'm a chartered member of IOSH. I spend a lot of time writing about health and safety for both Health and Safety at Work magazine and for the IOSH magazine. I do some day-to-day consultancy as well, which is anything from kind of quite mundane nuts and bolts audits right up to writing safety management systems for people. My ISO experience goes back a little bit further, actually. Back in 1987, I was involved in some fundamental research which went into something called ISO 9241, I think it was, on the use of icons in user interfaces. So my ISO experience goes back a lot further, but not in great depth.
Okay, well, I will put up my hand and say that I have nowhere near the level of experience that both you guys have. So I'm very eager to learn a bit more about ISO 45001 based on your experience. So let's maybe crack on straight into the questions. So maybe the first one to you, Chris. So a lot of talk about the context of the organization and you know, what is new in ISO 45001, and I suppose it's 45001.2 at the moment, compared to the OHSAS 18001. And you know, understanding the organization and its context, that's something that's new. So maybe you might just pick up on that and explain to us what that means.
Sure, Billy, and I think this is an important part of the standard, and I'm going to speak very quickly just to give you a few pointers about what context means. The standard requires the organisation to think about internal and external issues, relevant to the purpose of the organisation. So you've got to take into account the external factors such as the legal requirements, the social requirements, the financial sector that you may be in, the supply chain. Interested parties are in the supply chain. And you've got to take into account drivers and trend in your particular sector. And internal factors, the policies of the organisation, its capability and capacity, as I call it. So how capable is it for managing health and safety? The information systems that you have, and the culture and the workers' values. And I introduced into that the concept of interested parties, the needs and expectations of workers and interested parties. And workers are interested parties. And this leads into how leadership and how the top management is going to take all those factors into account. But particularly with interested parties and workers, it leads on to how are they going to consult and get the participation of workers. Perhaps you've got something to say about that, Bridget, on the interested parties aspect.
Yes, I think this is where I struggle with this being a standard to be audited against, rather than, you know, we've referred earlier on to HSG 65, you know, the excellent guidance that came from the HSE. And I think all of these are sort of laudable aims to involve stakeholders and so on, but I'm not sure how as an auditor I would ever go in and say, oh yes, you know, you've taken account of your context in the correct way, you've included everything that you should use. And when you come down to things like the active participation of the workers and how leadership relates to that, you know, as the saying goes, you can lead a horse to water. Yes. And I think it's interesting that that's reflected in the changes between the first draft of this standard and the second. So, for example, the first draft was trying to get you to audit against management ensuring active participation of workers, whereas now they've changed that to say that then this needs to be a process for consultation and participation of workers. So, you know, as a leader, you can put a process in place. You can't actually ensure what people do on a day-to-day basis.
So is this a big focus then on culture of the organisation, and it's really an attempt to try and bring that to the fore rather than dictating?
I think the problem with culture is it means so many different things to so many different people, and you know, I can go into organisations and I can get a feel within 10 minutes, you know, if when I walk in someone smiles and makes me a cup of coffee, I get a different feeling to if I walk in an organisation and the first thing they say is, oh, it's health and safety. But I can't audit. I can't write that down on an audit checklist. I can get a feeling about the culture. So I think that the idea with this is that you actually say, not have you ensured active participation, but with the new version, you actually have an auditable item, which is there a system in place for consultation and participation of workers? And that's something you can say yes or no. So I think that sort of item is okay to be in a standard. The idea of improving your safety culture is a guidance issue rather than a standards issue.
Sure, I think that you can feed that back into the discussion on context as well. How would you audit the context, and how can you get auditors trained up to know all these particular nuances in the various regions and nations and countries around the world? And there's two sides of this coin. It's either a get out of jail card free for the organisation who proscribe and say, well, we don't want to take into account that particular aspect. It doesn't apply to us. And on the other side of the coin is those who want the flexibility and they have a true integrity in wanting to do the best they can with the standard that can give them the flexibility to apply their own higher standards maybe than perhaps the local legal national one. And so the auditor has got to try and disentangle which side of the coin they're on. Are they on the good side, or are they trying to get out of jail free?
Yes, because I think the word that comes up in the standard quite a lot is consider, and then ISO define consider to mean it is necessary to think about but can be excluded. So I can sort of say, well, I considered talking to the workers, but I decided that I wouldn't, or I did talk to the workers, I listened to them, But then I did what I thought I should do anyway, and I can still get a tick in the box because I had a meeting where I talked to a worker about what they wanted, but then I did something completely different. So it's quite a difficult one to have in there as a as you say, Chris, you could have a good organisation who take that really seriously and who hopefully would very quickly see the value in consulting with their workers, because I think once organisations do start consulting workers, they realise what a valuable source of information they are. But if they do it if they pay lip service to it, then it's not going to have that effect.
Sure. Well,
yeah, absolutely, and I'm sure you guys would have seen it over the years as well. You know, as consultants, that you going into certain companies would be expected maybe to write up all the documentation and you know, not having access to the workers to see actually how the job is being done. And as you say, Bridget, they're the key source of your information in writing up the safety procedures and so on.
Absolutely. I mean, I turn work down if it involves me sitting at a desk and writing from a HSE guidance document, because I don't see that that's achieving anything unless I'm allowed to go and actually talk to the workers and watch them doing things and have a cup of coffee with them.
Sorry, Bridget. Sorry, guys. I just have a query here. It's just from one of our attendees. It says, Bridget, agree with your observation on difficulty auditing leadership and culture, but there are several positive and negative culture indicators which an experienced audit will be able to recognise and identify. Could you kind of expand on that, Bridget?
Yes, well, I mean, for example, the health and safety laboratories have done a lot of work on safety culture and have come up with quite a detailed questionnaire which can go out to workers and so on, and can give you some sort of numeric value for your safety culture. But that's not part of the standard, and clearly we're not going to get ISO to take on a British tool which has been developed by British health and safety experts to look at culture here. I don't even know if the same tool would apply. We had scandals with intelligence tests, didn't we, in the past, where we realised that measuring someone's intelligence is a very culturally biased questionnaire. So similarly, safety culture questionnaire may be very biased towards a Western European model. And I think making use of that safety culture tool within an organisation that's committed to improving its safety culture, it's an excellent tool to use. But it's not part of the standard as far as I can see. Yes, if I was doing an open audit within a company where I wasn't tied to auditing to a standard, if I'm going in and doing an audit where someone says, look, tell us what's good and tell us what's bad about the organisation, if they were using a safety culture tool across the organisation along all levels of staff, then I'd say that would be a plus point.
Yeah. Okay, and I suppose, Chris, like, you've travelled extensively, and as you mentioned that you've investigated accidents and incidents all over the globe. You probably see it firsthand, that cultural difference.
Indeed, there's a dichotomy here between a safe workplace and a safe worker, and where I go to places where they try to make the workplace safe, quite often they've not covered all the bases, and people fall through the gap either literally, or there's a piece not been considered for safeguarding some person and they die, versus the safe worker, where people behave safely regardless of their circumstances. And these are the survivors in the world. These are the survivor population. And neither is correct, but if you mix them together, you then end up with people behaving safely in a safe environment, and that's about as best that you can do. But I do find, for instance, I investigated a fatal accident in a Western orientated company last year, whereby it was left to the workers to get on with it. One person died, probably as a result of somebody's intervention by the second person, and it was there was no support in the organisation for that second worker, who had a guilty conscience, and sure enough, 2 weeks later he committed suicide. Survivor the survivor psychology was too much for him. Now in a supportive organisation, they would have said, okay, we didn't train you properly, we didn't supervise you properly. So there's an indication of how a different approach and different cultures can deal with these circumstances.
Yeah, fairly horrific when you see things like that. And it's, I suppose, just kind of picking up on a couple of things both of you have said there. So, am I correct in thinking then that there, as part of the transition from OHSAS 18001 to 45001, that there is going to be a kind of a difficulty there between auditors and their expectations and the organisations. There's going to be possibly an initial gap there where the company themselves may not understand fully what the auditor is auditing, because there seems to be that bit of leeway. Or am I correct in that assumption?
Yeah, well, that's right. And the reason why there's so much uncertainty about this standard is that the makers have tried to make it flexible and accessible. And in doing so, they've almost created objective setting requirements away from the prescription. And to extend that thought that you have there, Dave, is that, okay, the auditor generally deals with somebody at middle management and work level, rarely gets into the boardroom. But here, this standard requires the auditor to go and consider what the top management or the leader or the CEO is thinking and saying and doing. This is really quite a challenge, isn't it?
I think, and actually, Chris, I think you've identified actually one of the positive aspects of it, because I think it's been too easy in the past for boards to say to their health and safety team, go get me HSG 65 conformance audit, or go get me an ISO audit, go get me a BS. And this applies to quality and environmental standards as well. I've followed both in organisations before, and the top management can leave it to the team to go and get it. Whereas I think the good thing about this is that, I would like to think that anybody auditing to this standard will say, unless I have a meeting on day one with the CEO, that's it. Yeah. You've failed the audit on day one, unless I have that meeting with you and you explain to me how you see it. Because I do, I've come across some very senior managers who never talk to their health and safety team, let alone to a health and safety auditor.
Yes.
And I suppose that feeds back into what you were talking about earlier, Chris, the context of the organisation and considering all the interested parties. So, the CEO would have to be, the top person, the most interested party in all of this.
Yes, that top person will have had to consider those issues, and therefore the conversation between the auditor and the CEO is going to be an interesting one. Wouldn't we all like to be a fly on the wall of that one? And because that CEO has got to make the policy decision as to what's in and what's out. And I can see that being almost quite a defensive conversation with the CEO, and quite a long one. And I don't know, Bridget, how much time you normally give for an audit, but how much more time is needed to be added to this one?
I think it depends very much on the scale of what I'm doing, and that there are some audits I do in literally in half a day, and then there are some audits that take a much longer period of time. But it depends on the scope, and basically it usually depends on the budget, doesn't it, of what an organisation is prepared to put into something.
Yes. And of course this consideration needs to be documented in some way as well, doesn't it, in terms of what the decisions were, what factors were taken into account, and why they reached the decision they did. That's documented. So it may help in terms of having that information in the audit plan provided before you arrive, but I can see that some of these points will be something that CEOs would want to avoid doing in terms of having it documented.
Yes,
Okay.
because they're going to have to put in writing the sort of excuses for why, I mean, just basic things like, I think it's a requirement in this country for us to have some sort of health and safety consultation in workplaces over a certain size, and yet the number of large organisations I go to where it just doesn't happen, and they would have to at least defend that decision in writing as to why that's not being done. I'm still not utterly convinced by the idea of an international standard that everybody can follow, but I think within that standard there is a lot of useful advice and guidance. Whether it hangs together as an international standard, I think, is where I'm still to be convinced.
Yeah. I think there'll be an increased amount of support for this compared to OHSAS 18001. It's thought that there are something in the order of 150,000 certificates for 18,000. And my researchers and other people's researchers think that there's going to be 200,000 plus organisations will be interested in ISO 45001. Let's hope that's the case, but there will be those who are compliant because they are sincere about it, and there are those who are compliant who just consider it as a tick box exercise. So, and those are the ones where you consider, no doubt, Bridget, are those that perhaps shouldn't be in the game of trying to go to 45,001.
I think that to me the standard is the icing on the cake with a lot of these things, that if you actually have some sort of fundamental, I mean, let's for the sake of argument call them safety cultural issues in your organisation. If safety isn't integrated in what you do, but it's a sort of add-on that you do after you've done everything else, then why are you going for ISO or OHSAS 18001 or anything else? Why aren't you dealing with those underlying problems first? And to get those sorted, you need a different approach to auditing, which is not standards based. You need an approach to auditing which is appreciative, it's open-minded. You go in there and you say, well actually tell me what you're doing and how you're doing it, and tell me how you think it could be better. And you ask much more open questions than is there a process for consultation and participation? Yes, no. Is there this? Yes, no. It is that much more open questioning that I think a lot of organisations are still at that first level.
Yes.
Just a quick one, guys. I know we're kind of running out of time here, so we did say 20 minutes, so it's kind of running on nearly to 25. I just have one question, and it's just relating to going back to culture, and it's asking that as an auditor, can you justify that a safety culture is adequate and meets the standard, other than saying that an organisation does not have a safety culture program?
I think you could have a poor safety culture, but you could have a bureaucracy that enabled you to pass the standard. I don't think that passing the standard would prove that you had a appropriate safety culture. And similarly, you could have a really good safety culture without the documentation in place to pass the standard. Although I think in general, if you have a good safety culture, you are more likely to already have existing processes in place that would enable you to pass the standard. But I do think it depends on, as I said, it depends on where you start. I mean, I think John said this about the ISO 9000 program, that it became a system of documents rather than a documented system. And if you already have good processes in place, so if you have good software support tools to help you manage your whole health and safety management processes, then actually putting things in place to get the standard will probably be quite straightforward.
Yes,
you could bring in a consultant, in other words, to create a safety management system for you that would get you past the standards, but you could still have a bad culture underneath it. I don't know, what do you think, Chris?
Yeah, well, indeed. I mean, these are the tick box companies that organisations were referring to earlier. You'll probably understand the culture more when you have your interview with the CEO, particularly if it's you're asking searching questions. But yes, you're quite right that getting the accreditation could be much more straightforward than improving safety. However, the standard does require continual improvement. So in a way, it's beholden on the auditor to see what happened last time and compare it to where they are now. And if there's been no improvement made over that period of time, there'll be questions as to why they've not taken the opportunities for improvement. Again, this is sort of new territory, particularly for occupational health and safety. And then there are those who have got a genuine belief in the standard and will want to continually improve, and they may not start from a particularly high level, but they're still just past muster.
Yeah, and I think what seems to be coming across from some of the questions coming in is that, you know, the cultural aspect is one that does concern them, and, you know, in terms of how will the auditor actually gauge that the cultural identity of the company, the cultural performance of the company. And I suppose it's when the auditor kind of digs a little bit deeper, asking those probing questions that you mentioned, Chris, and also going back in the next time round to see, is there a difference, is there an improvement? And that's really where it's going to come to the fore.
Sure. Yes, and we did mention improvement, and again, my experience is showing that quite often people understand that they've had an accident, they know what the immediate causes are, they get an idea of what the underlying causes are. Then when they take those findings up to the CEO asks, well, what can I do? And that's where it all falls apart. And quite often you find with investigations, the CEO is not given the information nor gives the right sort of leadership to get the information to know what they themselves should do and should change to prevent that sort of thing. And quite often they just put more guards and more PP out there.
Yeah, yeah. Okay. Dave, is there any more questions?
I think we're just kind of running out of time here. So what I'll do is, if you can send me on any of your questions that you may have on the subject matter, and you'll have my email on the email that was sent out of the notifications of the webinar. What I will do is I'll be able to send you on the, I'll send you on, but you can send me on any of the questions and I'll send them on to the guys. I will also send you an invitation to Chris's LinkedIn discussion group on the subject matter. That'll give you another opportunity to express any concerns you may have on the subject matter, and probably for to further this conversation from some of the subject matter that's being discussed. So yeah, just first of all, thank you guys, and thanks for everyone for their time, and I think there's been some really good discussion and topics being brought up today. So what I want to do also is just to inform, I will be sending on the webinar recording to all attendees, and I will also be getting on to you next week when we will have a white paper specifically on the future of ISO 45001, and that will be an 8-page document that has been created by Bridget, and will be detailing all the information a lot of the information that's delving into more detail from what's been discussed today. So yeah, guys, I think it's like to thank all of you. I don't know how it be, I hope that all of you got be able to discuss the subject matter in detail.
Yeah, no, I think it was good. It's only a short space of time, so and such a large subject, so it's hard to cover too much. But I think, yeah, definitely around the cultural aspect and certainly leadership and worker involvement, there were some of the key areas that we did want to get across today, and hopefully we did that. But as Dave said, if there's any further questions, please let us know. And I'd like to thank Bridget and Chris for your time today. It's been great, and we hope to get you on another webinar very soon. But of course, you guys are going to be at our event in Birmingham next week on the 26th, where we're going to delve into 45001 in a little bit more detail.
Good. Thank you.
Thanks, guys.
Thank you, guys. Take care.
Bye.
Thank you, guys, and thanks for everyone for attending as well. Thank you.